And I would like to talk about multiple myeloma. Multiple myeloma is a malignancy of plasma cells, as we all know. It affects the antibody as the end product of plasma cells. So there is a monoclonal antibody for the patient with multiple myeloma. So the presentation of multiple myeloma, it's present as a crab. Calcium, it's a effect in the calcium level of the body, and also there is a renal dysfunction for the patient, and also patient present with anemia, and also they present with bone lesion. Most of the time it's a osteolytic bone lesion. So after this presentation, the definitive the investigation for this patient include the normal history of the patient and this thorough examination. After doing this, we go for a full blood picture. As we said, it can have anemia because of the overwhelming of the bone marrow due to plasma cells. And also we have to do the renal function test where there is a creatinine elevated together with the blood urea. Also it's affected. Also, we are supposed to do the bone marrow aspiration. And this bone marrow aspiration, we are going to see the lot of plasma cells, more than 10%. And also, if there is more than 60% of plasma cells in the bone marrow, that is definitive diagnosis for multiple myeloma, regardless of whether there is CRAB or not. So the best management for multiple myeloma, there is currently, due to evolution of science, the survival for the patient and the outcome is much more improved. There is a lot of drugs improved, and currently in our settings, we use the bortezomib, lenalidomide or thalidomide together with dexamethasone. And currently we go further high to the level of bone marrow transplant, which was done last year for only 5 patients. So coming to our settings, as we know, Tanzania is one among the low-income countries. We have limited number. We have a lot of patients, now patients with malignancy, as elsewhere in the world, they are keeping increasing. And in multiple myeloma, the incidence is almost 10% of all hematological malignancies, and as elsewhere it affects more male than female, but in our settings it shows that it appears in much younger age compared than developed countries. We got almost more than 10% of our patients, they have diagnosed under the age of 40 years. But elsewhere in the developed country, the median age of diagnosis is 70 years. And coming to the diagnosis of this patient, we go up to the level of serum protein electrophoresis. We don't have an ability to do the immunofixation in most of the centers, and also we don't do cytogenetics for our patients. So we go up to the level of serum protein electrophoresis, and currently only one center is able to practice immunofixations. And coming to the management in our settings, the Tanzania population is almost we have 60 million people as per last year's census, but the number of hematologists in the nation of 60 million people, it's only 25 hematologists, and there is only 60 centers in the region of more than 30 regions with hematologists in Tanzania. Mostly management is done in those 60 centers in this country, and also the availability of drugs is also limited. We have bortezomib, we have lenalidomide, but they are all not covered under National Insurance Fund. All these medication, they are such expensive, but patient supposed to pay direct from the pocket. It's not included in the insurance. So when we go back to the management, there is a lot of challenges. Even though we have the patient, some of them they afford to get the drugs, bortezomib, lenalidomide, but most of them they end up in palliative management because they don't have cash to do. So what is actually supposed to be done in our settings? First, to increase awareness from the low centers for early diagnosis of these patients. And in order to have this early diagnosis, we have to go downward, we as hematologists, to give education to low cadres in order to know that when we see these patients, we have to refer to hematologists. And not also low cadres, even to our fellow orthopedics, because we find some number of cases which attend to orthopedic doctors with the pathological fractures. And they are not going so further for evaluation, and when they come out to find out there is renal failure and anemia, that's when they remember to refer this patient to hematologist, and then lead to late diagnosis. And also there is a need to increase the number of hematologists. As I said, we are only 25 currently, so we have to increase the training. But good enough, we have we train hematologists here at Muhimbili University of Health and Allied Sciences, but there is a need to increase awareness and to make more doctors to come and join to hematology department. And also there is a need for the increase in diagnosis for multiple myeloma in order to know where there is a high risk or low risk. So there is a need of genetic setup. We have to make good centers for genetic diagnosis. And lastly, we have to have more training for us hematologists, to train more on new drugs, new investigations, new approach to patients. So there is a need of collaborations, and also there is a need of doing researches. There is a little bit a lag of research, especially in hematological malignancies, including multiple myeloma. There is a big impact for us as a medical personnel because in ecancer, currently we are talking about choose wisely. As I said, Tanzania and Africa, most of our countries, they are low income countries. So we have limited number. We have increased the burden of cancer. We have limited number of investigations. We have limited numbers of health personnel, and also we have limited number of medications. Together with also the medication for cancer, they are very expensive. So we are supposed to choose very wisely in our management. From the time of diagnosis, we have to choose very wisely in order to get early diagnosis. Early diagnosis will help. First of all, we are supposed to have on prevention. We have to prevent this disease. Then after prevention, will reduce the number of burden. how are you going to prevent? By first to change on the lifestyle change of the patient, of the society. Then after prevention, we have to do the early diagnosis. Early diagnosis will help us to have to choose wisely on early management. And also, we are supposed to use the small things we have, the minimum we have, to make sure that we choose wisely on better management for our patient in order to have a better outcome. So I think I see this event is very helpful because it teaches us, it makes us to remember to use the small thing we have in order to bring out a good outcome to the society.